Welcome to the Pharma Forum podcast. This is web editor Nicole Raleigh, and today I'll be speaking with Andrew Burns, Chief Revenue Officer at DrFirst, about the ramifications of delayed patient care when it comes to specialty medications. Welcome, Andrew.
Thank you, Nicole. Nice to meet you, and I appreciate you inviting me today.
So, since the year 2000, DrFirst has pioneered healthcare technology solutions and consulting services that securely connect people at every touchpoint of care to improve patient outcomes. Headquartered in Rockville, Maryland, DrFirst creates solutions to solve care collaboration, medication management, price transparency, and adherence challenges in healthcare. After all, the struggle is real. Prior authorisations, or PAs, have long put a burden on pharmacy and medical practices, ultimately causing delays for patients. Because specialty medications are extensive and require detailed approval processes, managing PAs for these treatments often causes delays and increases the risk of human error. Indeed, in 2019, the Council for Affordable Quality Healthcare, or CAQH, reported that PA's time per manual transaction increased from 16 minutes the previous year to 21 minutes, with a corresponding increase in cost from $6.60 to $10.92. In 2020, total spending on prior authorization increased to $767 million, with 86% of the expenditure incurred by providers. But before we sink our teeth properly into the topic at hand, Andrew, perhaps you could tell listeners a little bit about yourself and your journey to today doing what you do at DrFirst.
Sure, I'd be happy to do that. And that overview certainly gives us a lot to talk about as well today. But a little bit about my background. I'm the Chief Revenue Officer at DrFirst. I'm responsible for the sales, the client management, and the marketing efforts. We have really all about the commercial development and commercial operations for DrFirst. I've been with the company now 7 years. My background is, though, really focused on healthcare experience, in that digital healthcare is where I've been focused. I was with early days. I've been involved on the pharmacy benefits side, but I've spent the majority of my professional career on with digital health companies, including Hippocrates, Sermo, and Gobiquity Mobile Health, which my role in those companies was really to help build and operate individual businesses and help scale those businesses, as well as oversee corporate strategy that includes corporate development and M&A. What is the common theme across all those companies, and why I joined DrFirst, was really having the opportunity to help disrupt or deliver innovative solutions that disrupt the industry in terms of, at scale, finding ways to better patient outcomes. All of my experience has been involved in that in different ways. And the main reason I joined DrFirst 7 years ago was the opportunity to take what DrFirst had been really focused on in terms of the traditional electronic prescribing world of helping support providers in workflow, but really extend the reach of providers to allow patients to be more empowered and ultimately provide better health outcomes for those patients. So that's what attracted me here, and we've been busy ever since.
Gosh, yes. Quite a journey, and a necessary one at that. So if we turn back to our theme of the day, did you want to kick things off by commenting at all on the current landscape with prior authorizations?
Definitely, I can talk a lot about that. I think you covered it really well. When we talk about prior authorizations, there's a few clarifications or definitions that we want to make sure we talk about. When we think about where prior authorizations are occurring, it's primarily around specialty medications. I think the definition of specialty medications is used in that term is used in various ways. But when I think of specialty and specialty medications, it's really those medications that are high cost, high complexity, and also require a high touch, whether it be to supporting a prior authorization or administering on behalf of a patient. Those are the ones where prior authorizations are, the specialty medications are where prior authorizations are prominent. And what we know about prior authorizations is, or the specialty medications, is that they have a high cost. There's data out there in the industry. I know that today the drug spend is now tracking to more than half the U.S. drug spend is related to specialty medications. And that's growing considerably. Thus, you have organizations like the payers that want to make sure that the proper protocol and considerations have been made. Thus, they're instituting the prior authorization process. And that's where we know right now that's causing a lot of challenges in terms of workflow. There isn't consistent processes because some of the prior authorizations are covered under the pharmacy benefit for a patient. Others are covered for the medical benefit. It varies by payer and it varies by drug, where you could have a combination, even in some instances, on a specific drug of how it's covered in terms of the prior authorization and the reimbursement. For us, what we ultimately know is, and you were referring to it earlier, what are the challenges around prior authorizations? It's not only the administrative impact and the inefficiencies of getting a patient on therapy, but also supporting a physician's office to try to administer it, but it ultimately is impacting the patient. And I think that's where we know that physicians are recognizing that over 90% of physicians are saying that it impacts care delays in terms of getting that patient on the treatment regimen they wanted. There's actually also, they may give them a starter supply, but there's still an impact on their care. And you could disrupt their care where there's a gap as you're waiting for approvals and such. And ultimately, when prior authorizations do not go through, or they're held up in time because of rework associated with the approval process, about a third of physicians are saying that there are serious adverse events that occur because of prior authorizations not getting approved in a timely manner. So ultimately, the prior authorization challenge right now is it's increasing in terms of the number of drugs that are requiring it, the complexity across all the different solutions. And then really the biggest impact is what that's having on patient care and the impact it has, which we think we could argue is very clearly would have an impact on overall healthcare costs by delaying care and getting that patient on therapy.
Thank you, Andrew. Gosh, a lot of information there. So I just want to unpack it slightly for listeners,
Sure.
because it's all crucial to understand fully. So if we step back slightly and focus on the specialty pharmacy to start with, and specialty pharmacies, for those unaware, which most of our listeners will be aware, they offer services and medications to help treat, as you've been discussing, Andrew, rare and complex medical conditions such as cancer, rheumatoid arthritis, and multiple sclerosis, and many medications that those specialty pharmacies provide need special handling, storage, administration, and those specialty medications are usually, again, as Andrew has attested to, expensive and require prior authorizations by insurance companies. And from everything you were explaining before, Andrew, I was wondering if you could provide further detail on the financial implications and set the scene more fully, if you will.
Sure. Well, I think that the financial implications of when we think about that process, understanding how a medication has been identified for the treatment, it's really there where the physician office has to take on the responsibility. And this is where there's varying processes. Take on the responsibility of understanding whether or not a patient is covered for that respective medication. That's benefit verification. You'll hear people talk about BV in the industry. That is where the process begins. It has challenges. There are solutions when we think about drug information and the pharmacy coverage and how the health plans cover those respective medications. There's automated ways where you can look up a patient's benefit verification, whether it's covered under their pharmacy benefit, what their out-of-pocket expense would be. But for many of these drugs, there's also a medical component, and that doesn't have as streamlined of a benefit verification process. Every physician practice has different workflows of how they contact the individual health plan to understand what the coverage is, whether it's pharmacy or medical, whether there's a preferred drug that they may have to look at first-line therapy. And that's just to begin before they even start the prior authorization process. That's where there's decisions to be made, understanding what the out-of-pocket cost would be. In most instances, there are affordability programs like copay savings that are available if there is a high copay for a patient or high deductible, and there's patient assistance programs. But right there, that's a lot of work that's taking place in the industry. There are solutions that are in place where you can perform benefit verification. We have one ourselves with our real-time benefit verification on the pharmacy. But that's a challenge right now for a lot of physician offices, is to even understand where how it's going to be covered and what the out-of-pocket expense would be for a patient. And then at that point, there's a prior authorization process that's required to have that prescription approved, so that there will be reimbursement for a portion of that medication, and the patient then pays the copay, the differential in that cost. So right there, I've just walked through a long process, and that's just to get the patient prescription written properly, and then hopefully get the patient on therapy, or the steps towards on therapy, which is requiring a prior authorization.
Thank you, Andrew. So a word you've mentioned a couple of times now is workflow, and also the need for automation to help with this workflow and thereby, reduce human errors and thereby extension potential risks. So if we turn now specifically to DrFirst, and notably its acquisition of Mindshift Technologies, the intention there, so I understand it, was to address such issues through implementation of advanced AI and automation technologies, as well as a personalized mobile communication, Timely. That's the name, not saying it's a timely personalized mobile communication, though it might very well be in the grand scheme of things. And Timely provides patient supportive education on how to efficiently send prescriptions to the right specialty pharmacy, and thereby enable quicker processing. So Andrew, please can you tell us more about the importance of such advanced technologies for acceleration and risk avoidance in this process?
And I'll talk about Timely in a little bit in terms of that delivery, but really an overview of DrFirst in terms of what we are focused on, and it fits into what you shared a little bit earlier, but really we're focusing on the end-to-end journey and helping to optimize that end-to-end journey in terms of delivering the right information in a proactive manner at the right time. Thus, the connotation or the introduction of Timely. So for us, we're really focusing on a prior authorization experience, or an experience that may include prior authorization in the approval process, that has a seamless experience throughout the workflow of the patient journey. The workflow includes the delivery of information during the prescribing process, the right information to the provider, so that you can essentially be proactive to help them overcome those barriers, so they're properly informed about eligibility and verifying of the benefits, but also in that workflow, also allowing them to have the ability to make sure that if there is a prior authorization required, that we streamline the process, so there isn't an inefficiencies in terms of requests from the payers that with questions that could have been answered if we were proactive in terms of soliciting that feedback from the physician. And then finally, talking through that, once a prior authorization is in process, being able to communicate to the patient the status and keep them updated, so that then when the medication is filled, they can get on therapy quickly, and also make sure that they are on therapy in a cost-effective way. So ultimately, there's an end-to-end workflow that I've just described. From DrFirst perspective, we really do have a focus where, number one, we want to help support decision-making upstream. Ultimately, we want to avoid a prior authorization if we can. Can we make sure that the physician has provided all the necessary information that may not even require a prior authorization? Something as simple as a diagnosis code could actually avoid the need for a prior authorization, and thus get a patient on therapy sooner. At the same time, if there is a prior authorization required, our role at DrFirst and what we've developed with the acquisition of Mindshift, as well as our core businesses, we have the ability to help manage that prescription before it becomes a prescription on behalf of that physician, so that we can reinforce to them what information is needed. And we do that in a digital, automated way, looking at the patient record and being able to make sure that the prescription that is about to be sent has all the necessary information that will allow for that prior authorization to get completed the first time, as opposed to a payer asking for more additional information. We are trying to streamline that. We acquired Mindshift, which is really a way to help bring the office staff into the workflow as well. And it's also using AI and machine learning to allow us to actually be able to make sure that we have provided pulled in the right information, and then submit it in a streamlined way where we can actually automatically identify what health plan and send it to that health plan, as opposed to the office staff having to manage that in a more manual way. And ultimately, when we have that prior authorization in process, we want to, in parallel to that, communicate to the patient we talk to about 6 million patients per week in the DrFirst Timely solution. A subset of those have prior authorizations. We can communicate to those that there's a prior authorization pending. Stay tuned. We'll tell them to wait. If a prior authorization is approved, we will let them know it has been approved and how to get the medication. Or we'll also let them know about savings opportunities or better ways to access the medication. And even in the case that a prior authorization has been denied, we can help them get reconnected with their physician or connected to their specialty pharmacy to make sure that they help them get on the therapy so that ultimately we can help in a more efficient way get the patients on therapy. So our goal is using our digital technology of our core DrFirst, our MindShift assets, and what we're doing on Timely to actually allow for a faster speed to fill for patients getting on therapy and more patients getting on the therapy as prescribed by their physician.
Thank you, Andrew. One final question. What next for the field?
Well, that's probably another podcast in itself. But really, from our standpoint, I think we will see what we see as the opportunities is trying to avoid prior authorizations altogether. So how do we actually try to reduce those number of prior authorizations by being proactive in delivering the right information or extracting the right information from the physician before that prior authorization is required so that we can get the patient on therapy? We also see that there's ways to work with the specialty pharmacies so that we can get them more of the information that they need to support prior authorization. We have the ability to share more than just the traditional prescription. They may need more of the patient record, patient history. We can provide them that. And I think that's a big piece of it. And then ultimately, how do you continue to look to work with patients to help streamline and provide them more ways to get on therapy? So are there more affordability solutions, more patient assistance programs that we can connect them to? All of these combined will help streamline the process and help patients overcome that prior authorization process. That to me is where we need to focus right now.
Thank you, Andrew. It's been a pleasure.
Thank you so much. Have a great rest of the day.
And so that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on iTunes, Spotify, Amazon Music, Podbean, and pretty much wherever you get your other podcasts. Just search for Pharma Forum and press subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us as well on X or Twitter and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.